key steps necessary to decolonize humanitarian action would be mutual understanding of one another and our differences, empowerment of local staff, because they are the ones who will really determine the sustainability of any action that we take, as well as cross-cultural mentorship, where we learn about each other's cultures and we try to adapt to one another's cultures.
The three most important points are that we work on eye level together with professionals in the global south and the global north. Therefore, people in the global south need to be enabled. They need to get the resources so that they can actually work on eye level with people globally. And the most important thing is that we get away from sending out experts to other countries to try to help solving problems that people can solve themselves.
Now, from my point of view, to decolonize global health and humanitarian aid, one power needs to change. Countries in the global south need to start playing an active role on climate change. They have the lowest emission, but have the biggest burden of injustice. The other thing is thinking has to change. Identifying local solutions to address local problems is critical. Privileges and being heard, the voices of women and girls need to count.
In my view, decolonization of humanitarian aid has to go through three critical stages, represented by three letters: U, C, and A. U is understanding, C is committing, and A is acting.
To decolonize global health, it's necessary to give room to local experts and research to support local humanitarian actors like Red Cross and improve equity vaccines.
We can decolonize humanitarian action by keeping the needs and wants of the affected population in front of us, and we can decolonize the humanitarian action by ensuring that it is not the politics that dictates our response to humanitarian action, but the actual suffering. And we decolonize it by ensuring the knowledge and the voice and the authentic demands are coming from the people who are suffering and not from hundreds of experts around who tell us what the affected population needs.
Well, we need to challenge the perception that global health expertise exists only in Western countries. Moreover, we need to involve low and middle income countries in global agenda setting process, in global policy making, in health education, in research. And countries from the global south should, of course, have equitable access to pharmaceuticals, including vaccines.
I would say the most important step to be taken is to add more diversity to the levels of decision making in the humanitarian sector, in the way that decision making process is shared between the east and the west, or in other terms, the north and the south of the globe. So in another way, I mean that decision making is made in partnership between the people who are trying to help and the people who need the help. So not only the people who are trying to provide the help make the decision, but also those who need the help must take part in the decision-making process.
Decolonizing humanitarian action means that the focus should be on what people identify themselves as important. But what we have noticed is that priority is often given by donors or also by people who do not necessarily want to do harm to other aspects than the ones formulated by the people in need of humanitarian action. This needs to consequently change. Change now.